all of you. Today we learn about anatomy. History. From 300 before Christ and 2nd century, scientists, doctor, and artists would experiment on practice on the dead body. Cadavers were positioned flat on their rocks, thus making it easier to draw. Their back, thus making it easier to draw and reference from that position. 15th century Leonardo da Vinci of Italy, the originator of cross-sectional anatomy, was one of the greatest geniuses the world has known. He was founder of modern anatomy. Anatomy, meaning cutting up. Anatomy, the study of the structure of body parts and their relationship to one another. Subdivision of anatomy: gross anatomy, microscopic, developmental, and specialized branches of anatomy. Gross anatomy is also divided into regional, means all structure in one part of the body, such as abdomen or leg. Systemic means the body is studied in system like skeletal system, muscular system. Surface anatomy means study of internal structures as they relate overlying the skin. Microscopic anatomy, cytological anatomy, and histological anatomy. Cytological anatomy means study of cell, and histological anatomy means study of tissues. Developmental anatomy means study of developmental changes of body before birth. Specialized branches of anatomy. Pathological anatomy, study of structural changes caused by disease. Radiological anatomy, study of internal structure visualized by X-ray. Molecular biology, study of anatomical structure at subcellular level. Physical anthropology, applied anatomy means clinical anatomy, deals with the applications of anatomical knowledge to medical and surgical practices. Experimental anatomy, genetics. Importance of anatomical position. The interrelation of various parts of our body keep on changing in different position and movement. Example: standing, walking, sleeping, etc. Thus, relationship of structures has to be defined in a fixed position. Anatomical position. When a person is standing straight with eyes looking forward, both arms by the side of body, palms facing forward, both feet together, the position is anatomical position. Position and directions. Superior. The term superior refers to a structure being closer to head or higher than another structure in the body. Inferior terms refer to a structure being closer to the feet or lower than another structure in the body. Anterior refer to a structure being more in front than another structure in the body, means front side. Posterior refer to a structure being more in back than another structure in the body, means back on the back side. Medial refer to a structure being closer to the midline or median plane of the body than another structure of the body. Lateral means refer to a structure being further away from the midline than another structure of the body. Distal means refer to a structure being further away from the root of the limb than another structure in the limb. Proximal means refer to a structure being closer to the root of the limb than another structure in that limb. When you divide the skeleton into axial and appendicular, you can better understand the extremities and their roots. Superficial means refer to a structure being closer to the surface of the body than another structure. Deep means refer to a structure being closer to the core of the body than another structure. Ventral means toward the front or belly. Distal means toward the back. Prones. Lying face down means when a person lying on his or her face, chest and abdomen is said to be in prone position. Supine position means lying face and face up, means when a person lying on his or her back, arm by the side, palm facing upward and feet put together, the position is supine position. Unilateral pertaining to one side of the body, bilateral pertaining to both the side of the body, lithotomy position, person lying on her back with leg up and feet supported in a strap. This position is mostly used during delivery of the baby. Basic body plane or sections. These terms are used for a planes or a section that cut the body, organ, tissue or cell. Fixed lines of the reference along which the body is often divided or sectioned to facilitate viewing of its structure. Allow one to obtain a three-dimensional perspective by studying the body from different views. Sagittal planes. Here you can see that the plane dividing the body into right and left portion. Mid-sagittal or medial are names for the plane dividing the body into equal right and left halves. Frontal planes, the planes dividing the body into front and back portion, it also called the coronal plane. Transverse plane, the horizontal plane dividing the body into upper and lower portion, also called horizontal plane. Movements. Flexion, bending a joint or decreasing the angle between the bones. Extension, straightening a joint or increasing the angle between two bones. Hyperextension, excessive extension of a part of a joint beyond anatomical position. Adduction, moving a body part toward the midline of the body. Abduction, moving a body part away from the midline of the body. Pronation, turning the arm or foot downward. Supination, turning the arm or foot upward. Retraction, moving a part backward. Protraction, moving a part forward. Elevation, rising a part. Depression, lowering a part. Rotation, turning on a single axis. Circumduction, triplanar circular motion at a hip or shoulder. Internal rotation, rotation of a hip or shoulder toward the midline. External rotation, rotation of the hip or shoulder away from the midline. Movement of foots. Inversion, turning the sole of the foot inward. Eversion, turning the sole of the foot outward. Dorsiflexion, ankle movement bringing the foot toward the shin. Plantiflexion, ankle movement pointing the foot downward. Movement of the wrist and thumb. Radial deviation, movement of the wrist toward the radial or lateral side. Ulnar deviation, movement of the wrist toward the ulna or middle side. Apposition, movement of the thumb across the palm of the hand.